Welcome back to OpenLine tonight. I'm Carrie Sharp. I'm talking with Dr. Katie Foss from MTSU. She is a professor of journalism and strategic media, and we are taking a look at media coverage through epidemics and pandemics. You've written a book on it called Constructing the Outbreak, which was written before COVID, but is really relevant to look at now with COVID that we have it. 2 years in the rearview mirror. We'll see where it goes here forward. I think we're all kind of holding our breath still a little bit. I do want to continue this conversation on social media platforms and channels and how it kind of played a role that we've never seen before per se. And you're welcome to chime in as well. 615-737+ is the number if you have a comment or a question or would like to steer the conversation in a direction. We welcome that. I wonder, as you're in the classroom and you are guiding young students through this, what do you encourage them to look at of living through COVID, some as college students, maybe some as high school students, making that transition into college? What do you push them to look at in a different view?
Well, a lot of different things depending on our current topic, but I really encourage them to take everything with a grain of salt, that we don't need to just completely dismiss certain types of media content or media products, but you need to understand the perspective, the agenda, that what's the purpose of it, and really get out your toolbox of evaluating content. Is it intended to be satire? Is it intended to be informative? For whom? Who's the target audience? Is it really an ad? Is someone trying to sell something? That we have so much content that can appear to be something else or can be so misleading that it's important to understand how to evaluate it. And I think not just for students. I actually wish that everyone could take a course on digital literacy to better understand even what comes into your inbox for your email. That is this a scam? Is this legitimate? What are the, did somebody hack your account or is trying to, right? And not to use memes as information, for example, because all content can have value as long as we know how to interpret it and we know what to believe, what we can trust, and view that not as a yes or no in terms of can we trust it or not, but as a spectrum. And its purpose, is it supposed to be an editorial piece? Is it supposed to be something that's advising you to modify your behavior, for example? And that's a lot for students to understand. But it's also important, and to look at their own media diets as well. And
hopefully these students will become better news and information consumers, because there is a problem with that right now that's just been so exasperated. I do wonder, as we look at social media and the impact of COVID and the impact of politics, which we've really seen all collide, where do you think that we are headed when it comes to media playing a role in just daily life?
Well, I think I would divide out media, because again, that's a pretty big umbrella term that encompasses both mainstream media outlets, alternative media outlets, as well as the various levels, local all the way to international, and then also all that citizen-produced content. So TikTok videos and YouTube and memes and all that is part of media when we say media. I think that we're in for perhaps a cooling off period, not in our consumption, but the type of consumption, as we gravitate, as we were chatting a little bit about, towards more maybe uplifting stories and seeking to reconnect with others and others in our community, as well as friends we haven't seen in a long time or family members. And we're also going to see a continued generational gap between what are younger people using and what are older generations using in terms of platforms. How do you use it? How do you find information? Where do you go? How do you interpret that? And that continues to widen. What my students are consuming just for fun is very different than what I'm consuming or what like my parents' generation is consuming. And so we really need to acknowledge that and learn how to work together so that we can better navigate this media landscape.
There is so much information coming at us all the time, where it used to be, maybe in my parents' generation, definitely in my grandparents, it was the evening news at 6 o'clock, it was the morning paper, maybe it was the radio broadcast. And really, when it came to journalism, that was it. Now, there are so many different venues. And then you add in, like you said, the social media channels, the opinion writers, the opinion folks on TV, the talking heads, and the bloggers, and the podcasters, and it can really make your head spin, and it is too much to digest. You cannot evaluate all of it. And so it seems like we've just become bad at evaluating any of it.
Right. As some of my students have said, it's too overwhelming, so I just stopped consuming news.
Yeah.
And that's really not the answer. So I do think trying to find a manageable way to navigate and look for what are the topics that are really important. Daily feeds are helpful to make it a little bit more digestible, but then also verifying information. So if you read something and it doesn't sit quite right, or especially if it's really important, what other sources are you looking at that can back up that one? That to say, kind of give us another check on what we're looking at so that we're not taking anything at face value.
And also, I think it's also important to look at it in a sense, are you looking for affirmation of what you already believe, or are you looking for information?
Yes.
Because sometimes that can differ from what you believe, and that can also be hard to swallow.
Right.
And it's contrary to what many people want to see.
Yes, confirmation bias is a huge problem.
Yeah.
And you shouldn't just seek out messages that fit with what you believe. It's important to read and go across different perspectives. And again, with both local and national and international news as well.
And realizing that even, and I hate to keep picking on social media, but it is such a huge part of our lives that we are also being fed what we click on, because of bots and everything else.
And algorithms.
Yes, it continually pops up. It is there for your consumption, and that's pretty scary.
And that there are people who are intentionally trying to feed us disinformation and steer conversations away from fact-based evidence and try to influence our decisions, that it's not all just benign creations of disinformation because people don't know how to use social media.
I want to talk about your book a little bit again, Constructing the Outbreak. And for folks who maybe are joining us just a little bit late, this looked at past epidemics stretching far back and how media covered them. It was published just a few months after COVID came out, so you were able to squeeze in a few sentences. Will you write an update? Will you look back at COVID and with a new perspective and try another one?
Actually, I am. I'm writing a book on COVID and media right now.
Wow.
I've had to delay writing some of the chapters because the story is still unfolding. So enough has to be resolved for me to be able to say, and that's how that went, or at least through a particular lens, analyzing media coverage. But I have gone back to the beginning and started to write the diffusion of our information about COVID, looking at those first posts on social media sites out of Wuhan, and how the story unfolded. How do we even find out who found out, who was interested, what news groups, what health organizations, how did that come about? I'm looking at that story right now, which is really interesting because it all happened without me knowing about it at that moment, especially December 30th, December 31st, 2019. So there are parts that we can start to tell, but a lot of it is still happening, especially the pandemic impact, which we're not going to know for months or even years.
So what are you discovering? What are your little glimpses so far about when everything just started?
So while we dismiss and criticize social media platforms, they also can be really wonderful in allowing different people to have voices and connect with people around the world. So a big reason why we, even outside of China, found out about what was going on, especially as it started to spread, a virus spread outside of China, is because of social media platforms, because things could be posted by regular people and then released out to the world. So that's interesting. Who took an interest early on also is intriguing in telling the story. And when did people start to care? So the information was out there and building and cases were spreading to various places. In early January, the World Health Organization started releasing memes and other and infographics especially on warning people about what to do and what to look out for and everything. When did we start to care? It depends on where it's at, and not surprisingly, we care when it feels like a more present threat. The
like
Seattle
it's at your front door.
Yeah, absolutely, and just kind of how media outlets set the agenda for the different moments, rising up to the declaration of the pandemic in March 2020.
You said it was interesting who cared first. So who cared first?
Well, first, it was people in Hong Kong, not surprisingly, right? But also, different public health authorities. But then there's a few regular people who are pretty active on Twitter about COVID, and back when it was called mystery pneumonia. and shared stories, and I still haven't quite figured out why. Why do they take this interest so early on? Again, I feel like a detective, going back in time a little bit, at least in a safe, vicarious way, trying to piece this all together. And how did that impact other people? How did that impact, for example, travel? And not a whole lot until, of course, the cruise ships started to get quarantined. And then people's experiences on cruise ships were videotaped and released then on YouTube and other platforms. So again, while we can look back at social media as in many ways having a very harmful role with disinformation and misinformation, at the same time it really has allowed us to know about things a lot sooner than we would have had mainstream media outlets have access to get regular people's experiences and piece them together to the collective what was going on in that moment.
One thing that I noticed too, we talked a little bit about it from the news consumer's point of view, where people kind of really had to get used to, and some people never did, having this story unfold in front of them. They just wanted facts, what was true right now, what would be true always, is what they wanted,
and wanted it to be done. Let's close the door.
But public officials also at the very beginning, I feel, didn't want to say anything until they knew exactly what was happening, and that that couldn't be tolerated at this point. We had to know as it evolved.
And I would say that need to know before releasing information, of course, I mean, that's how scientists work when you work with evidence. But of course, the problem with that from a public perception is that, of course, that doesn't work, and it feels like withholding information when there just wasn't a complete set of data or information to be released, at least, and now not how we've always seen it. We've always seen it in that neat package delivered to us. That's not what can happen in an evolving crisis.
Nor have we seen, studies released within a month of happening or within days. Usually it is, like you said, years later, it's in a book, there you have it, it's done. And it was confronting in a lot of ways, just to the normal person, but I also think to the medical profession, to people who are knee-deep in it. It's just not the way we typically do things.
And to public opinion leaders who then had to convey the content to their audience or to other people. I think we're also just learning how to navigate a crisis in a new way that's really never been done before, at least not for this long.
Do you think, I hate to even ask this, do you think because of what we have experienced in the last 2 years, we would be better going forward if this happened again?
I would hope so, but I don't know. I just don't know, and I think that's what the last 2 years have shown us, is that we just don't know, and we just don't know how various people are going to react and what they're going to do, and even how strategically to deliver messages. And hopefully that's where we've improved. And how do you improve the communication and not just talking about like information delivery, but also improve communication across great distances or close distances when you just can't interact. But I don't know.
Yeah, I think it's something interesting when you talk about delivering information. I can see even our own health department in the metro area, how they really had to change how they do things to say, we are not getting minority communities to come get a vaccine. Like the numbers were so far down. So we need to change how we deliver that information. We need to change where we are. And it's, it really took taking a step back to see the bigger picture and say, okay, this is the direction we need to go.
And so hopefully those are the places that we can move forward with and learn something and improve for the future. Are okay, what worked, but what also did not work. The importance of having opinion leaders that are part of various communities to get people on board with vaccines and other mitigation efforts, and the communication to have plans in place at various levels so that should a crisis occur and we need to move quickly, what do we do?
Right. And I even think from a national perspective, it took a while for our national leaders to say, we need to be on social media channels because that's where people are. I was just getting ready for this. I read a Pew Research study that in January 2021, 86% of adults surveyed said they get their news from a smartphone. It's not clicking on the TV. It's not opening the morning paper.
Very different.
Yeah.
And that impacts everything from how do you deliver the story in a mobile format, but also how do you create the daily digest? What are people signing up? How do they want it? They want it in snippets. They want it in headlines. They want on something that gives them a good enough idea that makes them decide, is this worth clicking? And that's just a different way than thinking about the traditional news format.
Absolutely. We're going to pause for another phone call here. We have Jeff on the line. Jeff, thanks for being part of the show tonight. Go ahead.
Yes, ma'am. Thank y'all for taking my call.
Sure.
Social media is just driving me crazy. You know, you get something from Biden, you get something from Trump, and you just don't know which way to look. The thing with the COVID is like, how can you know what's the truth and what ain't? You got to wear the mask, ain't got to wear the mask, and I'm just trying to figure it out. Y'all help me out, and thank y'all very much.
We will try. You know, I think a lot of folks are in his perspective, just throwing up their hands like, I don't know what to do anymore. And it's totally fair because it is coming at you in every direction. What is your advice, whether it be to Jeff or to, you know, Johnny who called in earlier, or your students? How do you take it all in and find the truth?
Well, first of all, is there a truth, right? I would say just what is the best information, the most current information that we have across various media sources, across different news outlets, again, across local outlets, but also what kind of guidance are we getting from public health organizations to do this moment? Looking at, again, vaccine rates, looking at, of course, COVID rates and variants that are happening, but also that balance with, okay, are we going to shift into an endemic time? And how do you know? And I completely understand why it feels confusing. Right? This is another deviation from the past, is that we've never had a pandemic feel so long that there wasn't just a straightforward trajectory. That instead we have this up and down, this roller coaster of what should we do, what's okay, what's not okay, what's suddenly not okay, and how do we move forward from that. And I think that at this point, I feel like a lot of it is very personalized, right? That people are in different comfort levels, they have different comfort levels, they have different experiences. Some people are more medically complex or vulnerable in other ways, or have kids under 5 who can't be vaccinated. And so at this point, again, it's very much a personal decision versus when it was widespread mitigation efforts because nobody could be vaccinated because the vaccine hadn't been developed.
All right, we're going to take another quick break. We will be right back after this.